much. Thank you very much, Goof. Thank you very much, Eric. Thank you very much, Didier. And thank you all for being there. I fully understand that for some of you, I stand before lunch, between lunch and you. So I'll try to keep you up a bit. So Didier asked me to talk about intersectoral action, local intersectoral action, more in terms of in the community. So how it works in community. And our research program in Montreal has been for the past 15, 20 years, trying to understand, you know, what does it do and how? So what does it produce? Is it real that we should be doing intersectoral action for health locally? But how can we do it? So I want to start by actually, it's an African saying, and I understand that some of you in Africa know that way better than I. If you want to go fast, you go alone. If you want to go far, you go together. And I mix that with a very Canadian picture of northern geese that travel 4,000 kilometers together like that in two bout of 2,000 kilometers. So they go pretty far together. And when you see them in a field, there are hundreds of thousands of them. And really, you can understand that you can go far. But there's a flip side to that, though, because you cannot go fast. And if you think it's easy, then you better go alone, because it's not just by putting people of goodwill and who have good intention together that you will go anywhere. So these are the lessons that we've learned observing the work of tens of intersectoral projects unfolding in Montreal. So as a premise, so we need to know and we need to understand, if we want to be serious about intersectoral action, that health is produced in everyday life. If you think that health is produced by healthcare professional, then you don't do intersectoral action because it's a waste of time. You just repair what's broken. If you think that you need to work ahead and change the conditions in which people live, love, play, and work, then you're likely to be to need to go with those who have the control over those environment, which is usually outside of the healthcare system. So what we've observed by years of research is that over and above individual risk factors, health indicators cluster across neighborhood. Just to give you an example, in Montreal, for example, the life expectancy difference between the neighborhoods where the richest people are and the neighborhoods that are least of lower socioeconomic level, there's a 10-year difference in life expectancy. So, and the life expectancy, if you live in the high-income neighborhood, is close to that of Japan, and the life expectancy, if you live in the most deprived neighborhood, is closer to that of Bolivia equator. So there are differences, and those differences, what we believe is explained, at least in part, by the quantity and quality of resources that people can access to in their daily life. So we conceive of context as a network of relationship and resources that is produced and reproduced through people's practice, and that in turn shapes people practice. So, for example, if there were nobody buying cigarettes to local stores, they wouldn't sell cigarettes. So they sell cigarettes because there's a demand for cigarettes. But at the same time, they sell cigarettes so people can buy cigarettes and smoke. So how, and it's not just by telling people, hey, stop smoking, that people do stop smoking. So there is a relationship between the context we create with our practice and the practice that we perform, creating this context. Okay, so you cannot just change someone's behavior independently of the context. And if you change the context without engaging with people, it will not just stick together. So, and those local resources are clearly outside of the healthcare system. They are clean air, parks, safety, access to health food, access to clean water, and so on, and so access to good school, and so on and so on. And these are the material with which individuals create their health. So how can we, or how can public health engage with those sectors to create the context in which people will build or will create their own health? So one of the tools for that is called intersectoral action. So what is intersectoral action? So we usually define intersectoral action to include the collaborations between sectors of public action. In other words, public actions is divided into sectors of action. So typically in a country, you have a minister of education. So that's the education sector. You have minister of transportation. So that's the transportation sector. And usually those ministers don't talk to each other. They each have their budget, they each have their mission, and the mission of a school usually is to educate children. It's not necessarily to put them in good health. That's usually the mission of the health sector. So when you want the health sector to talk to the educational sector, and that's what Wi-Fi was talking about. I mean, how do you do it to make a school talking to a hospital? Do you do it to make the mayor talking to a hospital? So, and it's just because you put them in a single room that they will talk the same language. So if we believe that context is important to create health in people's daily life, then we need to bring those people together. By extension as well, we will say that intersectoral action also includes collaboration between the various forms of action. So in the public domain, we have the state that is a big actor, institutions and state. But we also have the private sector, the market. If you want to buy some cigarettes, you usually don't go to a state-owned store. In Quebec, if you want to buy alcohol, you go to a state-owned store, but that's another story altogether, okay? But usually products are acquired through the market. And so you have to have usually some market people as well around the table, and their mission for them is to make money. And you also have civil society organization whose mission is usually to serve their community. So you have various missions, so various areas of action education, transportation, safety. And you have various ways of operating: the state, institutions, the market, private organization whose mission is to make money. So how do you tell a local grocery store to sell healthy food if they make more profit selling junk food than healthy food? That might be a little challenge there. And as well, you have the civil society, whose role is to serve their group of people. Also, when we're discussing intersectoral action, we're discussing several levels of collaboration. So some intersectoral action happens regionally, locally, centrally, even internationally. So if you're discussing intersectoral action, you need to state at which level you're discussing, what kind of public actors, institutions, market, or civil society, and what kind of sectors. So that's also something that we need to be aware. What I will be discussing is local intersectoral action, which is a specific form of intersectoral action. What I was saying is it's not just by putting people together in a room that you will get integration and local sector and action. Because when people try to coordinate and work together, they lose their autonomy. So they lose, there is something to gain and there is something to lose. What you have to gain is to go further. What you have to lose is your own autonomy towards your own mission. So that's why most of the study who have examined the ways in which local intersectoral action is implemented have shown that most efforts are at the very low end of collaboration. So there's usually an incremental ways of thinking about intersectoral action. So the first level is information exchange. So I will tell you what I do, you will tell me what I do, and you will tell me what you do, and then we exchange, okay? There's still a high level of autonomy and a very low level of interdependence. The second level is coordination. In addition to information exchange, I will tweak some of my activities at the margin so I can at least link them with yours. An example of that is, okay, so I will tweak my, in a school, I will post a sign that says no smoking in this area. Doesn't cost me. I did not alter my school very much, and I please the healthcare sector. Cooperation. Not only do I alter activity, but I share resources. Aha. I use one of my rooms in the school for a nurse. So there is some sharing of resources. The room, I could have done something else with it. And the greater interdependence and the lower level of autonomy for each of these sectors to work on their own mission is a mutual benefit. So not only do I share resources, but I formulate my mission in a way that includes the shared vision that we develop together. So An example of local intersectoral action is the Montreal Initiative for Social Local Development. So it is three funders: the Montreal Public Health Directorate, the United Way of Montreal, which is a charity that collects people to help local initiatives, and the City of Montreal. So together, they put $3 million per year, which is more or less 1.6 million euros. And they work with the coalition of Montreal neighborhood committees to fund 30 neighborhood roundtable coalitions. So these coalitions are made of the local neighborhood actors. So there's usually the school sector, the primary care sector, the police, but also the civil society, the neighborhood, the daycares, the housing sector. So their work is to perform a local needs assessment that includes people and that mobilize the local community people. And they collaboratively work to developing a work plan to address those needs and the implement action related to these work plans. At the local level, this cycle of work usually takes between 5 and 10 years. So if you think that by funding a project for 2 years, you will end up with any change at the local community, you're in big trouble. So these things takes between 5 to 10 years. So I say it at the very beginning: if you want to go fast, you go alone. If you want to go far, you bring people with you. In our observation, we've observed that those coalitions work on issues of urban design, environment, education, economic development, housing, transportation, safety, employment, nutrition, culture, and sports and leisure. So they have a very broad area of action that address most of the determinants of health. Our main results. So, as I said, what we observed is that they produce actual transformation in their local community. Those transformations relate to material resources through the built environment, but also through social resources, new services, new programs, new activities. But what we've observed as well is that solutions are not developed through following a linear process. So there's a lot of back and forth. There's a lot of turning around. There's a lot of discussion. So these coalitions do not produce these transformations themselves. Most of them, they do not produce these transformations themselves, but through the production of what we call transitory outcomes, which are the ways that the action progress, okay? So if the plan is to create a new hothouse, for example, in a poor neighborhood of Montreal, to help produce vegetable for the local market, it's not done just like that. You need to go through a lot of back and forth, a lot of those transitory outcomes. What we've observed is that those transitory outcomes follow three broad categories of functions, and we're pretty sure, because we've validated that those coalitions do essentially three things, and that's why it takes time. The first thing, or the first of their function, is they have to constitute and maintain themselves. So that means, who do we invite in our coalition? Why do we invite them? Okay, how do we work together? So these are all decisions that kind of slow down action, but that are necessary if you want to go far. Okay, so, and we need to pay attention to those functions, to each one of these functions. So constituting and maintaining a local coalition is as important as digging the ground to plant a tree. The second function, and that's where they start to be visible. So the first function is oriented towards the coalition itself, whereas the second function is oriented towards the outside. So what they need to do is to represent themselves and influence. So because at the end of the day, the third function that is critical is to align actors and resources to produce the transformation. But that's why coalition produce a lot of papers. They do meetings with the local people. They listen. They try to organize, and they try to bring in their project those who own the resources. So representing and trying to influence is one of their big way of doing things. And finally, the third function is really to align actors and resources, because those coalitions usually have their resources are for their own mission, for each organization mission. So if they want to create transformation through a shared goal, or they need to align the resources towards that goal and to bring the actors that will get those resources. So at the end of the day, if we try to bring some conclusion to that, so what are the conditions for successful local intersectoral action? Well, I would at least 6. Inclusion of the wide range of perspective on the situation. So if the more people around the table that are relevant to the situation, the more likely that the solution will be effective. Early participation of partners, but also, and that's why it's important, the early is to include them in the strategic choices. If you want to go somewhere and you want to bring a lot of people wherever you're going, might as well decide with them where it is that you are going to go collectively. So strategic decisions are important. They are usually early. They influence the whole work, and the earlier you bring your partner into the situation to get their perspective and their vision of where it is that you need to go, then the more successful, the more likely you are that your coalition will be successful. The actors engaged need to feel that they can influence the process, that they are not there to fill out chairs. Another condition is the mobilization of strategic and neuralgic actors. So those the people who are concerned with the situation. The major pitfall of local coalition is power differentials. So you need to have procedures in which the local gorilla is not going to bully everyone around them. And usually this is where the function of creating and maintaining themselves for coalitions are extremely important. And finally, you need to co-construct the collective vision and the collective action. So if you want to know more about that, they are in French. They are in the process of being translated. Eventually, we will get them in English. But what we have in English is a whole series of web-based tools that are available through webinars in English. So this one here is in English, and this one is in French. It's the same thing. It's our tool for appreciate local intersectoral action. Thank you very much.